Emptying sensory disorders and speech learning difficulties. So, first is hearing impairments. Now, let's discuss the hearing mechanism and the mechanisms of loss. So, there we have four components: the outer ear, middle ear, inner ear, and the auditory nerve and brain. So, first, sound waves enter the outer ear. So, there's what we call pinna or earlobe, collects the sound, and then the middle ear, which is the eardrum or the tympanic membrane, and there's an ossicles there, small middle ear bone, so they're the ones responsible to amplify the sound. And then after that, the inner ear, which is the cochlea, and then there's a lining there called basilar membrane, and the cilia, which are the hair cells responsible in converting the sounds to neural signals. And then the auditory nerve would be the one to transmit it, and then the brain processes the sound. So basically, that's how like hearing works. And then these are like possible damage area to each component. Profiles of hearing loss. So first is the type. So there are four types. We have conductive, there's a damage in the outer or middle ear, and then sensory neural, inner ear or the nerve, and then a mix of both. And then lastly is the central hearing loss, so meaning there's a brain injury or a damage in the CNS. Next is the degree. So it could be slight, mild, moderate, severe, or profound. Configuration, so we have flat configuration, meaning there's an equal loss in both frequencies. Sloping, meaning there is a loss in the high frequencies. Cookie bite is a loss in the middle frequencies. Reverse slope is the loss in the low, which is rare. And then could be unilateral or damage in one ear or bilateral. Then onset, so it could be congenital, prelingual, meaning before the acquisition of spoken language, and then perilingual is during or the developing stage, and then postlingual is after the acquisition of language. Last is the assistive devices, so there are two: hearing aids, which amplify the sound, and then cochlear implants, which help stimulate the auditory nerve. Communication and social cultural considerations. Different modes of communication. So we have oral, doing speech or speech reading, manual or basically sign language or finger spelling, or what we call a Rochester method, and then total communication is basically the use of any or all modes of communication, and then SIMCOM is a mix of both, and it's usually interchangeable with the TC, but SIMCOM is more of a type of TC. Sign systems differ from sign language in that they attempt to create visual equivalents of spoken words through manual symbols. So here in sign systems, they basically use the English language with prefixes, so they have signs for it. And then conceptually accurate signed English, or what we call case, is the use of ASL signs based on meaning but in English word order. And then cued speech, so a form of simultaneous communication, but unlike SIMCOM, the signs are specific hand shapes provided as cues to assist children in clarifying English speech reading. Language development and competency, so they could be delayed or not depending on a number of factors, including the onset, the effectiveness of amplification, the appropriate choice of communication mode, education, and also the availability of excellent language models in all aspects of the child's life. So one instructional approach, bilingual, bicultural approach. So advocates believe that ASL in their setting as a first language can lead to linguistic competence, and then English is better learned as a second language in the context of a bilingual bicultural approach. So the main obstacle about it is finding teachers who are sufficiently fluent in ASL or SL plus a deaf culture. And then hearing impairment describes all hearing loss, and using of hearing impaired is considered offensive. Problems resulting from hearing loss. So, a loss in early childhood could mean speech and language delays, problems in following directions, poor discrimination of sounds, awkward social interactions, and social isolation, as well as academic difficulties. A loss acquired in adulthood could lead to isolation, low self esteem, changes in lifestyle, and as growing up, there's limited incidental learning where learning informally by engaging in or overhearing conversation is limited, and then reduced auditory feedback in communication. Music perception and enjoyment. So it differs from people depending on their hearing history and profile. So if they occurred a loss in adulthood, they already know what music sounds like or supposed to sound like, the particular structure, features of the music itself, and then the type of assistive device used, and their personal background and preferences. So musical sounds may not always sound good or natural through hearing aid, but it's much better compared to implants, because in cochlear implants they only take different frequencies that is suitable for speech or enough to understand speech, while hearing aids amplify the sound received received. And then children with enough residual hearing, so they have more accuracy in low pitches, but it also differ. And then pitch discrimination improves with increased intensity or loudness, and then large pitch changes are easily perceived compared to small ones. Accommodations in MT and music education. So first, you should set up an optimal acoustical environment. And then acoustical accommodation should have like carpeting, curtains, soft surfaces for less reverberation or echo, and good lighting for speech reading. And then selects musical sounds and activities that are adequately accessible, and then communicates in a manner that facilitates clear and effective interaction. So when selecting appropriate music and instruments, try to use rhythmic instruments with large vibrating surfaces, the low frequency ones like drums, or you can also do piano, bass tone bars, and xylophones. And instruments that require constant tuning is much more challenging. So you can also do trial and error depending on what works for them. And then accommodations for communication, you should always meet them at their present developmental level. Consider the system of communication. If not trained, ensure to hire a qualified interpreter. Music therapy goals and interventions for individuals with hearing loss. So goal area first is auditory training, so to improve their sound discrimination, sound detection, sound identification, comprehension of the sound. So the first step is always sound detection. So you can do rhythmic cueing or using low frequency vibration based instruments for that game or for that sound detection intervention. And then speech development, increase use in free vocalization, increase awareness of their speech patterns, the production of a more natural speech rhythm, pitch, the inflection, and factors that influence intelligibility. Then try to collaborate with a speech language pathologist if not trained, so you can sing with visual models, vocal imitation, and pitch matching games for it. Next goal area is language development, so to increase an appropriate use of vocabulary, increase spontaneous or topic-related interaction, increase complexity and completeness of sentences, pragmatics, and the use of language in context, so you can do lyric creation or songwriting, sign and sing activities, fill in the blanks. As for social skills, to improve their turn taking, eye contact, group engagement, following directions, so we can do structured ensemble, drumming, musical games with visuals. So here we have an assessment tool called Meadow or Kendall Social Emotional Assessment Inventory for deaf students that assess their emotional and social competency, and then emotional support to build confidence and expression, and then songwriting, improvisation with expressive instruments. Next is vision impairment, so let's identify some terms. Legal blind, so their visual acuity is of 20/200 or worse in the better eye with correction. And then there's different levels of vision loss. Blindness, so complete absence of vision. Use tactile and auditory senses na. And then low vision, so they're partially sighted, so they use optical aids and can read print. And then functionally blind, uses braille and uses functional vision to do activities. Tunnel vision, so they are able to see objects within an area of 20 degrees or less. Poor central vision, so only good at peripheral vision. Then visual efficiency is what we call efficiency in using residual vision. Etiology may include congenital anomalies, retinopathy or prematurity, glaucoma, cataracts, macular degeneration, trauma, infections, and other genetic disorders. Residual vision, and then functional vision, where residual vision is sufficient for ADLs. Characteristics of vision loss by domain. So first is cognition, so they could have difficulty with visual learning and concepts. Language may be intact but with limited vocabulary related to vision. Academic achievement, delays in literacy and math due to lack of visual input and materials. As for social development, they could have a risk for isolation, low confidence in group settings, social cues. For motor skills, so they could be delayed in gross and fine, and then orientation issues, unsafe navigation, locomotion, moving from one place to another. The term visual impairment includes a range of visual acuity, any amounts of functional vision. As for visual acuity, measures the distance at which an individual can clearly identify objects, and then the losses can be acquired or congenital. Age of onset is considered for adjustments, and then large print and braille may take time to read, and then always consider the age of onset, severity, family support, type and degree of education intervention when writing your treatment plan and doing your sessions. Music therapy goals and interventions for individuals with vision loss. So here, music can be used in different ways. In this setting, it can be used as a structured activity to facilitate learning of academic, motor, social, and verbal behavior, as a stimulus or cue or prompt for sound localization and other listening tasks, as a contingent reward, and as a part of music appreciation and enjoyment. As for the goal and intervention for the listening skills, to improve sound localization and attention as well as sound discrimination, so you can use sound matching games or instrument identification. And then for OM, orientation and mobility, to improve spatial awareness through sound. So orientation is being able to determine one's position in relation to the environment, and mobility is just moving from one place to another. So you can do echolocation games with percussion and call and response, or dance for balance. And then daily living skills to increase their independence and personal hygiene. So you can use song cues for task sequencing like brush, 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 or rinse. For social or interpersonal skills, so you can foster group interaction to increase their confidence, turn taking, greetings, eye contact, table etiquette, and a positive sense of self. So you can do duet singing, turn taking in musical improvisation, music listening, music performance or leisure, and then emotional expression development. So you can provide a safe outlet for emotions to improve self-esteem. So you can do lyric discussion, composition based on feelings. As for academic skills, so you can reinforce concepts via music. So you can use musical mnemonics for math or spelling, music-based counting with braille. And then reduce sensory stimulation behavior, so replace the repetitive behaviors, body rocking, poking or rubbing the eyes, or head rolling, through rhythmic regulation using drum circles, movement to music, instrument playing to replace the behavior, doing it with physical assistance. Empty in speech and learning difficulties. Speech defects, aka speech or language impairments. So these are communication disorders, could be stuttering, impaired articulation, language or voice impairment. So the areas affected include articulation, fluency, voice, language could be receptive, expressive, or mix of both. For the characteristics, so there's an improper use of words and meanings, inability to express ideas, inappropriate grammatical patterns, reduced vocabulary, inability to follow directions. As for the causes, could be hearing loss, neurological disorders, brain injury, ID, drug abuse, physical impairments such as cleft lip or palate, vocal abuse, or misuse. Now let's be familiar with the different speech defects. So first, apraxia. It is an expressive disorder. They could be late talkers, abnormal mouth or jaw movements, emphasize syllables incorrectly, and inconsistent pronunciation. To compare with aphasia is a language and speech disorder. So the difficulty is more on understanding language and expression. Next is stuttering. So there's a repetition of sounds, interruption of speech, overuse of fillers like and it can be developmental or neurogenic. The next is lisping. So these are like sounds associated with the letter S and C, so they have difficulty in saying those. And there are different types: interdental, lateral, palatal, and dentalized. Spasmodic dysphonia, so there are abnormal spasms in the vocal cords. So voice can sound strained, tight, soft, or hoarse, or jittery, and then the onset is usually on 30 or in 50. And then cleft lip, so there's an opening in the upper lip, and then cleft palate, so the roof of the mouth are not completely joined. Next is learning disability. So according to IDEA, so a specific learning disability means a disorder in one or more of the basic psychological processes involved in understanding or in using language, spoken or written, which disorder may manifest itself in the imperfect ability to listen, think, speak, read, write, spell, or do mathematical calculations. So these include perceptual disabilities, brain injury, could be minimal brain dysfunction, dyslexia, or developmental aphasia. So basically, it can affect one's ability to read, write, speak, or spell, wrong spelling there, compute math, and reason. It can also affect their attention, memory, coordination, social skills, as well as emotional maturity. So people with learning disabilities, so they have differing capabilities. Just because they have it doesn't mean they are not gifted as well. So some are intellectually gifted. The condition affects their input or the ability to process incoming information or output using information in practical settings like reading, spelling, or math. So the causes could be pregnancy, illness or injury in early childhood affecting brain development, contact with damaging material, neglect, additional physical disabilities, and or sensory impairments. List of learning disabilities. So dyscalculia from the word calcu. So it's more on math. So it affects a person's ability to understand numbers and learn math facts. And then dysgraphia is more on handwriting and fine motor skills. Dyslexia is more on reading and language-based processing. And then nonverbal learning difficulties, so problem in interpreting nonverbal cues like facial expression, body language, and may have poor coordination, and it is not officially listed under IDEA or DSM-5. However, the impairment associated in this one include motor skills, visual spatial organizational memory, and social abilities. And then lastly, oral or written language disorder and specific reading comprehension deficits. So it affects an individual's understanding of what they read or spoken language. Then impairment in semantic processing. So semantic processing is the encoding of the meaning of the words. And then syntactic processing is understanding the order of words and its different meaning. So these are some MT interventions that you can use. RSC, MIT, OMREX, and DSLM, APT. Then you can also do collaboration and other music activities. So a different video will be provided because these are NMT techniques. So that's it. But before I end this video, let's define some different terms to be politically correct. So hard of hearing. So hard of hearing are those people who generally respond to speech with the use of their residual hearing through hearing aids or cochlear implants, and their primary and preferred mode of communication is speech. To compare with the deaf, with the lowercase deaf, so these are individuals where their residual hearing is not sufficient enough to process speech, and their primary means of communication is manual communication. Now to compare it with the capital D deaf, so these are people who uphold the values of the deaf culture and use ASL or SL as their pride in their cultural identity. So this includes them, the family, or the children or close friends who share the values as well of the culture. So their primary mode would be the sign language. And usually they don't use any medical assistive devices. So this is the end of the video. Thank you so much for listening, and if there were any information that was incorrect, feel free to comment down for me to be educated as well. So thank you so much.